Hi, today for our clinical reasoning series, we'll talk about problem representation. So what is problem representation? Problem representation is setting up the stage for the HPI that's coming afterwards. It is the one-liner, but the one-liner with substance. Tell your residents to think about how they see cases presented in an EJM. It's that one-liner that doesn't give you piles of information, but just enough to trigger differential diagnoses. To guide your learner, you can tell them how to build a problem representation. Problem representation is usually built out of three things. First, it tells you who is the patient. Second, it gives you the clinical syndrome, or what the learner thinks is the patient's central clinical problem. And third, what's the timeline of those symptoms? You can even give a couple of examples to your learner. Here we can see a 30-year-old female with shortness of breath for 2 weeks generate one list of differentials. Now if you change that to a 45-year-old male with CHF and the same clinical history, a different list. Now change the timeline to acute. Again, a different list. As you can see, this is really useful for you and your learner, because by using problem representation, you get to see if your resident can actually define what the patient's central clinical problem is, if they can generate differentials, and by this, you prevent premature closure, you make it easier for them to access their illness scripts and diagnostic schemas. An important way of teaching problem representation during rounds is not letting your learner fixate on one diagnosis right when they're starting to present the case. Here you can see on the first example, the patient is giving a diagnosis right off the bat. Ask your learner to reframe their diagnostic possibilities and use the second example. Another key point in teaching problem representation is ensuring that the learner is updating that statement as more information becomes available. For example, that patient that came in with a cough on the first day of hospitalization but now has diagnosis as CHF should be presented and documented as such. Amazing! Now, if you want to learn more about how to use problem representation to then teach diagnostic schema, watch our next video. If you want to learn more about problem representation, click on the link.